Will be joining community healthcare workers on a vaccination drive to encourage people to get vaccinated if they're eligible. Gauteng Premier Makhura speaking. Let's cross to that now.
Those questions. And it's often about people saying, I'm taking some medication, I'm not sure if it's safe to take vaccines. Vaccines do save life. We want more vaccines, but we want the underground machinery to be able to reach people where they are. That's what we are demonstrating this week. It's not just for this week in Gauteng. We are going to be doing that every week. I know that we have a lot of people on the ground. Some of them themselves are not vaccinated who are doing this work. They ask questions like you journalists. They say, we are not. We are part of the people who are doing door-to-door work. We are not vaccinated. We're really confident that we will get more vaccines to also be able to vaccinate all those who are working, including the various categories, people with comorbidities, people under the age of 50. But we first have to really ramp up and reach out to all those 60 and above and those in their 50s, and all the teachers and all the health workers and all the law enforcement officers. We want to reach them, and those who really have question marks, the best thing is they need to go to the relevant people, and they will get answers that are satisfactory for them to be able to take the vaccine. But we are very happy with the reinforcement that we have received from a very experienced health professional, a very experienced administrator, Dr. Zungu, who is now in charge of the Department of Health in Gauteng. She's already started getting the ground machinery working. And the MEC would particularly like Dr. Zungu to share with you guys what the Gauteng province is doing to really galvanize the response to this wave adequately. Dr. Zungu, Dr. Sibongile Zungu, the acting HOD of Health. I would like to move.
Right. Thank you, Premier. At this point, as a province, we are looking at actually starting at ground level with the vaccine mobilization. And as you have seen that we already have our ward-based outreach teams, it's not only for those that are in health to mobilize people for vaccination, but leadership at all levels, community groups, religious groups, everyone. It's everyone's business to ensure that everyone that qualifies for a vaccine gets vaccinated. For us as the Department of Health is to ensure that the vaccines are there and we reach people according to their need. At this point, we are looking at vulnerability, and we are looking at people that are above 50 years of age and those that are in the groups that have been identified, like the police, the nurses, the educators, and others. So the department then is looking at every avenue, every transport mechanism, every area. Very soon you will see the mobiles coming through, especially to those areas that have socio-economic vulnerability, like this particular area, like the West Rand, like you'll see if in Citybang. You are going to also see that there is going to be work that is being done even in the taxi ranks. When we come to the age group that is 18 and above, we will just have to go everywhere because that's a huge component of the population of Gauteng. Mostly it's young people, and then we'll have to reach them. But for now, we are looking at those that are vulnerable and protecting their health, as the vaccine is able to prevent severe illness and death. And that is the number one ammunition that we have in our arsenal for the fight against COVID-19. Thank you.
Thank you very much, colleagues. I don't know if there are questions. Okay, Joseph, number one from Bali. Pen, number 4. Or 5. Okay.
All right. Premier, I'd like to know, as Kaya, we visited a number of demobilization sites in Tembisa as well as El Dorado Park. Some of them were not functioning, some of them were. So clearly there are gaps in terms of delivery. How do you intend to fill some of these gaps? And then just another question, the Lambda variant is on the horizon. We don't have it here, I understand, in SA yet. What do we know about this new variant? What do we know about it?
Okay. Bali?
I think just to add to my colleague's question about the Lambda variant, we understand that it hasn't arrived in the country just yet, but there are concerns that the health department might be downplaying the different variants, because at first we were told the Delta variant was not in the country, and now we've seen it basically taking over in this current third wave. So can we just get clarity with regards to the Lambda variant, and maybe just measures in terms of ensuring that it's detected quite easily and quickly, given the fact that it's also vaccine resistant. Second is the issue of ambulances. There are issues with ambulances in the communities in Ekurhuleni complaining about ambulances not arriving on time, and sometimes, actually most of the time, arriving after a patient has passed away. So we just need to get clarity as to how these cases are prioritized, and does this mean that the ambulance system or the healthcare system is somewhat being overwhelmed, given the fact that we are experiencing the third wave? And are we anywhere near the peak of this third wave? Is Gauteng anywhere near the peak of the third wave?
Thanks, Bali. Pen?
Mine is simple. From the Sowetan. How many sites are active at the moment? What is their average daily vaccination? How many people are being vaccinated on a daily basis, and how many are you adding in the coming days? How many sites, additional sites are going to
have? Just to get clarity, the elders were the first target. So now that hesitancy, does it undermine the target that you were hoping for as the province? And you mentioned that tomorrow the teachers, I think it's the deadline, but Joburg North 97%. You have like the overall of Gauteng, because there was a statement from the Department of Education that 10,000 teachers are saying no to vaccinations, and 97 is for North. But province-wise, and how are you dealing with that? Yeah.
Okay, let's just take those ones. You're going to come on yourself. So in the next round will be the two.
In the next round,
okay.
Okay. The HOD will respond to...
Yeah, just make sure that those cameras, can you guys pick her up? The camera. So can you pick her up? Okay, all right.
Thank you very much for the question. I'm going to answer the question, Yama ambulance. Yes, we do have a challenge with regard to ambulances not arriving on time. But last week we also had a meeting with private sector, because what is basically happening, the ambulance is arriving late because of the referral system. So we have agreed with private sector that we are going to have one center that will be able to refer ambulances where they are supposed to be referred. So the COO will be working with private sector so that we can be able to have that one system. Like when I was here, I received a call, and then I managed to call the ambulance, and then it arrived on time. So that is the referral system that is a stumbling block that is making us not to reach ambulances on time. The other thing that we have done, as you know, that ambulances has been provincialized. So now we have also issued a temporary license because of the COVID to City of Tshwane municipality, and then the other municipality that has applied is City of Ekurhuleni. So combined, we will be able to respond to our communities on time. So I just wanted to clarify that we are working on it. We are aware that it's a challenge, but we are really working on it, and we have also brought in private sector, because as well, if they are not well coordinated, it creates a problem. Thank you very much.
Thank you very much. HOD? You can step forward, Mami Kanyan, so the cameras can... Guys, ready there? Picking up?
Right. In terms of the daily target, I'll just give you an average on a daily basis. For the past week, we have been averaging around 18 to 20,000, and we have increased again with about 10,000 since we started on Monday. We are seeing a trend that is going up, and we would like to see a situation where by the end of the week we are going towards 30,000. And actually, given the sites that are being opened and the response that we are getting, it seems like those that are above 50 are more tech savvy, and they are able to register themselves, and they are getting their messages, and they are also coming through, walking into the sites. The walk-in program has given an advantage to be opened up, because most of the people decide sometimes at that point that they are coming through for the vaccination. So we are quite encouraged by that response.
How many sites are they on?
I'm trying to work out how many sites are there. I don't have the number on hand at the moment, but
It is more than 183.
Yeah.
Vaccination sites.
Yeah, correct.
And would you be putting more?
Yes, we will definitely be putting more, and the mobile sites are actually, on the 183 that are there, the mobile sites are linked to a facility. So you might see the facility is not increasing, but satellite sites would be linked to one particular site, because we do that to monitor the vaccine and to be able to register the batches that we are giving out, to ensure that we are having that pharmacovigilance, to ensure that we know who was given which vaccine.
Thank you very much, Premier.
Okay, so let's start with the side. So our full...
I think, Premier, if you can face the camera there, because this is only voice, yes.
So we have 183 sites that are currently operating, but in our plan we want to activate up to 250 sites. That's the part of when we get more vaccines, we want to activate 250 sites, which include non-medical sites and communities. There are medical sites which include clinics, hospitals, but we also want to include big non-medical sites. Also in partnership, some of the big non-medical sites are in partnership with the private sector, like Discovery. Together with Discovery, we are very happy that the private sector is coming to party to support us, ensuring that we've got big sites in some of our areas that are easily accessible. So we will be satisfied when we have active sites that are more than 250 on the ground. By yesterday, I saw the national numbers. Gauteng and KZN vaccinated 35,000 people. Yesterday, I saw the vaccination numbers. Ask us, we want to double the numbers. Remember, we want to double the number of the current daily registration numbers we are doing. We want to double them. How are we going to double them? We are going to double them by increasing the sites, by increasing the number of vaccinators. Dr. Zungu has been talking to the medical schools in our province. All the medical schools and the universities will have agreed that they are going to release medical students to complement our human resources, both in the vaccination program but also in the clinical services. Students who are mainly in their final year. So Dr. Zungu has been talking to all the medical schools. There's agreement. She's just finalizing that. We will get a lot of the medical students who are joining these teams, both the vaccination teams on the ground, but also clinical interventions in the hospitals to manage the beds, the COVID beds. We are also bringing in lots of partnership from the private sector and the NGO sector. We've got the NGO sector in the health services that are also bringing their services. That includes also the ambulance services. We work with the gift of the givers. They are doing great work. There are also other NGOs, the Right to Care, who are also bringing their own expertise into this. We are coordinating with the private sector much better, not just on ambulance services. Again, Dr. Zungu has been leading a team with our health team just to make sure that there is better coordination between private health and public health. Ambulance services, but also bed availability. When there are beds in the public sector, the private sector needs to know that there are beds. And when there are beds in the private sector, we need to know that they are beds. So at the moment, yes, both the public and the private sector in Gauteng has got a huge load, but coordinating and working together will help us to know where can we transfer patients, where is the intervention. This includes also making oxygen available. And what I can say is that so far oxygen security has still been guaranteed. Our health team led by Dr. Zungu again has been engaging with AFROX, who supply oxygen. One of the important things is also about ensuring that there's availability of oxygen in the primary health care services. We see it in the private sector where people are also taking some oxygen to people who prefer to be treated at home. So when you face this kind of a third wave that is as huge as that, we have to do things we have not done before. We have to do everything that it takes. And we need everybody on board. We want these partnerships. We can't afford to have the public sector working alone. We need this support from everybody. A number of you asked a question about the new variant. I just want to say we had our provincial coronavirus command council yesterday. We meet every Tuesday. We have received a report from our modeling team and our group of scientists who are tracking everything. All we know is that at the moment, the Delta variant is the dominant variant in our province, which is the one that's driving all the infections. I think unfortunately, we knew too late to do something about it. But we know that this monitoring is done at a national level. We are assured that the NICD and the team in KwaZulu-Natal University is doing it on behalf of the country. And we will get briefings from time to time just around where things are. So from where we are sitting, we are unleashing the resources and the energies we have to deal with all the challenges we are facing. We know that there will always be national briefings if there's a new variant that is really a variant of interest that gets picked up and the briefings are done. I'm sure there's lots of interest. This was raised in our discussions yesterday about the new variant. There's lots of interest out there. But if you ask us, what we are dealing with now is really the ravaging impact of the Delta variant. And the best way to deal with this, the scientists are saying that we must do everything. The fourth wave may be ahead of us. That's why we have to vaccinate and vaccinate and vaccinate and vaccinate. And that's really the best thing. We have to deploy all the vaccines we have in our hands to make sure that ahead of whatever new variant may develop, we will also know from the scientists if there's a new variant, how the different vaccines are responding. But it is better. It's a better and safer thing to do, to try and vaccinate as many people as possible, in particularly those who are most vulnerable, ahead of any new variant. Coronavirus is going to be with us for a long while. The safest bet we can do is to get the vaccine out to more and more and more people, so that we can also, as a country, say that we are able to go on with our own lives. Even if the virus is still out there, the vaccine is the only way that will help us do that. But we don't want vaccines to come and then there's no uptake. That is why we are doing what we are doing right now. These categories that are supposed to vaccinate now, yes, we were very, very concerned of hesitancy amongst the elderly people. But you know what? We are turning the corner. Getting to them and getting to understand what the issues are is important. As I said to you earlier on, some of it just has to do with the fact that there are people with comorbidities or they have other ailments. They just didn't know who to ask. And there are also people who have been saying to us they've had lots of stories about vaccines. We are reassuring them. So we can't reassure them by not being where they are. That's the difference, is that we have to be there. We have to be there with them. We've got to get into their homes. We've got to understand what challenges they face, and we've got to address those challenges. I am very confident, MEC and HOD, that we are going to increase, we are going to see significant increase in the number of people who are vaccinated in Gauteng by the end of this week, but we are not stopping this week. This way is going to be the way to do it all the time. The ramping up and going into people's homes and increasing the number of sites and increasing the number of vaccinators is going to be the way we do this. And I can tell you, when we get to the 40s, we are going to have a big challenge. Gauteng is a youthful province, so we've got a huge population there. We better deal with the category, especially of the 60s and above. I can say to you that with the health workers, we also did very well. We vaccinated, before this week, we had vaccinated 92% of healthcare workers in Gauteng. And I'm saying before this week. We had a problem with the teachers, about close to 10,000, 9,000 or so teachers who were not taking the vaccines. But we are hoping with the work that's being done this week, that even that number will be significantly reduced. There's still a few healthcare workers who didn't take up the vaccine. We hope even with the teachers it will not be a lot. We will reduce that, but we want as many people as possible who qualify to take the vaccine. The 60-year-olds, there are many reasons. But this week you can see that the 50-year-olds are really responding extremely well. And we don't want to forget that there's still a large number of those who are 60 years and above. We want to continue reaching out to them the way we are doing. But we are very confident that the vaccination program in Gauteng is going to make a very positive impact. Yes, we won't change the third wave trajectory. And someone was asking, how far are we going? Have we come with the third wave? Our team of scientists yesterday presented a report. We think we are very close to peaking. We can't say to you we will peak on this date. The pandemic is trajectory is a function of what is happening. One thing I must thank the people of our province about is that we have seen in the last week and a half, we have seen improved compliance. When people do this, they need that feedback. We have seen less movement up and down. Mobility has slowed down. People are going out only when it's necessary, including those who are going to work. So 2 weeks ago, we were saying we are very worried there's too much movement. We have seen significant improvement about compliance, but also the law enforcement officers have really been active on the ground. So we must thank the people when they are responding. We want to thank the people because they are responding, but we can still do better. Gauteng can still do much better in this regard. So I am confident that we will reach the peak pretty soon. The numbers we hit on Saturday of 16,000 had a very shocking impact on all of us in terms of daily infection. The 7-day average, which by yesterday the 7-day average we have reached is double what the highest 7-day average was during the second wave. Our 7-day average in terms of infections was about 9,000 by yesterday when we got the report. But we still have to do everything. We still want to say, let's observe the health protocols. We want to encourage people not to be doing unnecessary movements. But we are upscaling in every respect. Enforcement and compliance, we are upscaling. There are a number of places that we have also been shutting down that don't comply. We are not complaining about that. We just, if there are places, whether they are commercial places or they are places, workplaces or public transport nodes where there is no compliance, we are taking action about that. And this is what is really going to help us. So we're hoping that we will. But we want to say that even if we reach the peak in terms of infections, the hospitalization is going to continue to be a very big problem, because more people who have been infected so far are going to continue to get into our hospitals. So we are doing everything there. We have been clearing a number of beds in our hospitals to ensure that there's space for those who need COVID treatment. Our hospital CEOs have been doing a great job to create additional capacity, including additional spaces, and the provincial government has also been working to reallocate resources to ensure we bring more staffing. I know in the report yesterday we were given there will be additional absorption of 1,400 staff to manage existing beds that are created in the public health sector. So every week we are dealing with additional pressures and additional challenges. But the best thing we want to say is that this too shall pass. We will get to the peak, and we can only get to the peak better when we are all cooperating. But we must not be lulled. Unlike the previous peak of the second wave, we must not be lulled. In fact, even if we get to the peak this week or in 7 days' time or in 4 days' time, even if we reach the peak, we are going to continue to up the game in vaccination. We must never think that we have reached the peak, so we slow down in this, because the next third wave or fourth wave is going to be coming on that. So we are not going to be lulled in our vaccination program by whether the numbers are coming down or not. Even if the numbers were to come down, we are going to continue to ensure that the vaccination program is stepped up to the maximum. So thank you very much.
Thank you.
Let's take the rest for Friday opinion.
Yeah, let's just, okay, Friday.
One more. This is over.
You guys okay?
No, good. No, there's just the two that I cut them.
Oh, okay. You guys need to take that? No?
No, wait.
That's fine.
I think we'll
Okay.
cover it.
Very sharp.
No, I don't want to talk about what the national team must do. We are focusing on what we must do now.
We're done.
Give him mic. If I know,
This one.
Focusing on.
Right, we come out of that media briefing by Gauteng Premier David Makhura, and as he goes on a vaccination drive, trying to stop vaccine hesitancy, saying that more people are now willing to get vaccinations. And so we come out of that and bring you some